Good evening and welcome. A very pleasant good evening to our respected dignitaries, distinguished guest speaker, esteemed doctors, teachers, students, and all homeopathy lovers joining us from different parts of India across the globe. On behalf of the International Forum for Promoting Homeopathy, IFPH, I extend a warm and heartfelt welcome to each one of you to the 2157th day of the uninterrupted daily webinar series. I am Dr. Rinkle Advaryu and it's my privilege and pleasure to be your moderator for today's enlightening academic session. Before we begin, I kindly request to everyone to keep your microphones on mute throughout the session, keep your video on if possible, and join using your full name. You may post your questions in the chat box and we will take them up during the discussion session. The International Forum for Promoting Homeopathy is an international humanitarian organization dedicated exclusively to the promotion of homeopathy worldwide. It unites the homeopathic professionals, teachers, students, researchers, and enthusiasts beyond the regional, religious, political, or ideological differences with a common mission to strengthen and advance homeopathy globally. Today's webinar is another step in that noble mission to to continuous this academic learning. So now introducing today's guest speaker, it is now my proud privilege to introduce our distinguished guest speaker for today. We are honored to welcome Dr. Poonam M. Meghani ma'am. She is an MD, M.Phil and PhD, currently serving as a professor and head of the Department of Gynec and Obstetrician as Kamdar Homeopathic Medical College, Rajkot. She is also a successful clinician practicing at Meghani's Homeopathic Center, Rajkot. Dr. Meghani has enriched her academic excellence through the advanced training, including the Triple C certification by CDSE and the prestigious Residential Research Methodology course organized by RFRF, Nagpur and Saurashtra University. She has actively participated in numerous national scientific seminars, workshops, conference, Hanuman Day Global Marathon, the Global Ayush Innovation and Investment Summit, and several professional training programs. Her academic contributions are reflected through the multiple evidence based publications in reputed national and international journals, particularly in the field of thyroid disorders, anemia, hyperthyroidism, urinary tract infection, LM potency, and ovarian system management. Her dedication to teaching and clinical practice and research has inspired many students and practitioners. Ma'am, we are truly honored to have with you us this evening. Introducing now today's topic. Today's topic is homeopathy for fertility, a holistic approach to parenthood. Infertility is not merely a medical condition, it is an emotional, psychological, and social journey for many couples. Through a holistic and individualized approach, homeopathy aims to support overall health while addressing the unique and needs of each patient. We eagerly look forward to learning from Dr. Meghani's rich clinical experience and evidence based insights on this important subject. Without making much of your valuable time, it is my honor to invite our respected speaker, Dr. Poonam M. Meghani ma'am, to kindly take over the session and enlightening us with the valuable knowledge. Ma'am, the virtual stage is now yours. Welcome once again.
Thank you so much, Dr. Rinkle. And good evening, everyone. We'll begin our session.
Yes.
Yeah. Today's our topic is homeopathy for fertility. I'll not say infertility. Rather, it is giving a negative impression on the patient as well as the doctor also. So we'll moreover look over toward the fertility. So it's a holistic approach. In homeopathy, we are treating the patient like a natural way. We are supporting the natural reproduction. So a patient itself generate its natural immunity, and towards this addressing the physical, emotional, and lifestyle factor. So over 200 years of this homeopathy proven practice. So homeopathy offers deeply personalized solution. It crafted resonate with your unique journey and towards the conception. Moving towards the fertility, so it's not just a conception, it is just more than the conception. So fertility means the natural ability to conception, right? Here infertility means the person is failure to conceive within 1 or more years of regular sexual intercourse. So if we see globally, around 1 in 6 couples experience infertility, whether it is male, female, or male is responsible for 40%, female is 50%, and around 10% of all couples are responsible for the infertility. Now, if we look towards the physiology of this, there are four main basic factors. We can say this is a cycle. So if we miss one of the era of this cycle, we miss the whole fertility ratio. So this for the successful conception, we require a healthy ova, healthy sperm. The tube should be patterned. The efferent duct should be patterned. There should be a receptive endometrium, and there is a adequate amount of sperm should be present for the fertilization. So, we all know that fertile period is very limited during the menstrual cycle, that is between 8 to 10 days to 15 days. On the day of 15, there will be ovulation. So, before ovulation, 5 days, and after ovulation, only 1 or 2 days is useful for the fertilization. So if we see ovulation, fertilization, implantation, and pregnancy, if we miss one of the factor from this, we miss the fertility. Now, we have seen that male and female both are equally responsible behind the case of infertility. So we're looking towards the causes of female infertility, moving towards the ovary side. So if ovarian function is mismanaged or distempered, that will lead to ovarian disorder. One of the commonest thing is PCOS, polycystic ovarian syndrome. So it is related with whether premature follicles or hypothalamo pituitary axis disruption or any thyroid disorder. This will hamper the ovarian function and ovarian disorder can happen. Towards the tubal factors, so fallopian tube, if there is any like acute salpingitis or the blockage, or there is previous history of pregnancy, so this and one of the good factor in case of India, that is tuberculosis. So tuberculosis, if there is previous history of also tuberculosis, the tube can be damaged at any level, and then it affect the fertility of that patient. Moving towards the uterine factor, uterine fibroid, polyp, congenital anomalies, and intrauterine any abnormality, specifically factors related abnormality that may create the fertility disruption. Now, endometriosis and the age factor. So, for the endometriosis, chronic inflammation, specifically, it will distort the endometrial cavity, and it will hinder the implantation. If we see towards the age, it will reduce, the egg quality will reduce by age, specifically below over the 35 years of age. Even the quantity reduce and quality also reduce. So after the age of 35, the fertility rate is almost half of than the normal age. Now, the causes of male infertility. So, as we have seen the female infertility cause, the same way towards the male infertility also. We move towards from normal to abnormal. That is, if sperm is not normal, sperm abnormality is there, whether it is count abnormality, morphological abnormality, or physiological functional abnormality. Then testicular cause. For the testicular cause, if though sperm is formation inside the testis. So, is there is any abnormality related to the testis or testicular disorder, that definitely hinder the path of sperm, and there is no fertilization. In case of male also, hormonal disorder plays a greater role. like hypogonadism, pituitary disorder, thyroid dysfunction. This will hinder the formation of sperm, and definitely the fertility rates reduce. Lifestyle and medical factor, if we discuss, nowadays obesity, heat exposure, uh, some genetical disorder, the lifestyle habits like smoking, alcohol, or any other pan gutka, this will definitely affect the sperm quality and hinders the fertilization. If there is sperm is normal, ova is normal, but the lifestyle is not that much adequate, so that will definitely reduce the fertility. Here, there are some key points for lifestyle disorder that will silently killing the rate of fertility in that patient. The first one, that is obesity. Obesity directly not working towards the reducing the fertility, but obesity will long-term obesity specifically, but that will reduce the uh, normal amount of hormones. So there is hormonal imbalance. There may be insulin resistance, and this will lead to reduction in ovulation and also reduction in the testosterone hormone. So obviously the spermatozoa count will reduce. Now, the poor diet. Nowadays, processed food, trans fat, and excessive sugar food is available in form of chocolates and ice cream and all. So, this will definitely less in nutrient. So, people are using some processed food, so they are less micronutrient. So, it will affect the health of the patient, and definitely that leads to hormonal imbalance. Sedentary lifestyle. Moreover, those who are working constantly in the sitting position, not doing any physical exercise, so that will definitely reduce their metabolic rate. BMI is high, and obviously that lead to obesity. And obesity again will leads to hormonal imbalance because of this reproductive distress. Now, sleep deprivation, because of this all altered hormonal imbalance or increase or reduce amount of hormone, that will alter the cortisol level. That will alter the cortisol level and disrupts the melatonin impact. Now, this melatonin impact will definitely reduce the reproductive hormone, that is testosterone and estrogen. So again, that leads to hinder the fertility ratio. Smoking alcohol, we have already discussed, that will reduce the quality of both ova and the sperm. And there are also definitely reducing the risk, increasing the risk of miscarriage and oxidative stress. Now, the stress, mental health, and fertility. So, as we have seen, stress directly doesn't create infertility, but stress will impair the pathway of fertility. How it impaired? So, chronic stress will activate the hypothalamus pituitary adrenal axis. Now, because of this activation of axis, there is increased cortisol level, and this increased cortisol level will suppress the reproductive hormone, GnRH, growth hormone releasing hormone, luteinizing hormone, and FSH. As the quantity of FSH and LH will reduce, there is definitely affection or definitely reduction in the for maturing of the ova. So there is primary follicle are present in the gonads, ovaries, testes, but there may not be maturation of the ova, and that will leads to anovulatory cycle or delayed menses or irregular menses. So such way, the stress and the mental health will hinders the fertility. And obviously, because of this stress and mental health, that will reduce in treatment rate also. So if we see psychological effect, anxiety, depression, there may be marital stress, or and this will leads to stress pathway activation, and that will lead to reducing libido also. Now, environment we are living around the environment, so environment and modern risk factor. Nowadays, so much plastic use is also there. So through our routine lifestyle, we couldn't come to the that effect of plastics. But because of that long-term uses, it will definitely hinders our endocrine pathway, and because of that, our reproductive function and the natural hormonal production is reduced. And till we come to know that imbalance, we are far away from the factor. So why it matters? So first of all, endocrine disruption. So how endocrine disruption? It is through biphenyl, bisphenol A and phthalates. Bisphenol A and phthalates, the two are the chemicals that blocks the natural hormones and directly that interfere in the reproductive function. Now we are nowadays using BPA-free plastics, BPA-free bottle, BPA-free container, but the routine foods which we are eating, it's always containing some more or less amount of BPA around it. So it will definitely impair our natural hormonal production, and we come to long way we come to for the infertility. Air pollution. So nowadays air pollution has so much increased because of global warming and all. So heavy metals and other things are present in our environment. We are assuming that air, and that will definitely reduce the rate of fertility. Some heavy metals, radiation, and excessive heat production is there around the environment. So that will increase the stress. While if we see the digital lifestyle nowadays, so digital lifestyle like sedentary lifestyle, screen addiction, less physical activity, and this all long-term create the sleep deprivation. Sleep deprivation will leads to again psychological factors, stress and imbalance that will definitely affect on our normal hormonal production. Occupational risk, that is specifically those who are working with the high temperature factories and all, night shift works, that will reduce the sleep, and that will affect the fertility. Now, clinical presentation, how a male or a female come to us, which signs they come to us for the infertility. So specifically, if we go for the female, there may be first and foremost sign is disturbing in their cycle, irregular periods or amenorrhea or a long way of period. Then dysmenorrhea, there is a heavy bleeding and pelvic pain. Dysuria, for those who are having married, they will having the painful intercourse. Galactorrhea, acne, and hirsutism. These are all the commonest factor of PCO. We'll see in detail later on. Then male comes with us for the scrotal swelling or varicocele. There may be erectile dysfunction, ejaculatory disorder, either early or late ejaculation. Definitely, they will reduce the sperm motility also. Previous history of mom's orchitis or testicular pain. So these are the warning signs for the male and female that click our way for fertility. Now, if the couple is coming with us, at which duration that we need to seek the evaluation? First, there is no conception after recommended duration. So, after so many times they are planning for the pregnancy and there is no conception, or there is conception but recurrent pregnancy loss. Recurrently, they are having losing the pregnancy. Then any known reproductive disorder, previous surgery or chemotherapy. There might be so many things that comes to us. Now, we are here for optimizing the natural fertility. How we can improve the fertility naturally through homeopathy, through diet, through exercise, and some reducing the risk factor we have seen that we can that are in our hand. We can reduce that, and we can improve the sleep and the stress management, timely intercourse during the fertile period, that will definitely help us in increasing the natural hormone in our body, and we will comes to the natural fertility. So infertility is rarely caused by a single factor, that no male or no female singly responsible for the infertility. Both should be equally treated, and this often result of multiple underlying medical condition, and that is affecting that male and female or the both the partner together. Now, moving towards the detailed factor for fertility, that is PCOS, which is the global problem nowadays. So it is the most commonest endocrine disorder in the woman during their reproductive age. And there is always anovulatory or delayed menses or irregular cycles. It complexly, not directly, but complexly it affect the hormones and metabolic function of ovary. And because of it, infertility generated. Now, what is the pathophysiology symptom and the diagnosis of PCOS? How we come to know that person is having PCOS, right? First of all, it is having oligo or anovulatory cycle. There is delayed menses or irregular menses or scanty menses. There is weight gain. There is absence or either absence of menstrual cycle also. There is acanthosis nigricans, the neck area and the back of the neck will become blacker and darker, thicker skin. There is the hirsutism, extra growth of hair on unwanted area like a cheek or neck or any other part of the body. Then hair thinning, lots of pimples and acne over there. So these are the common symptoms which we come to know from the PCOS patient. Now, what is the reason behind this? Okay. There is always hyperandrogenism, and because of hyperandrogenism there is a disturbance is specifically low estrogen and progesterone level. It will leads to irregular the cycle, and there is a higher amount of androgen, specifically testosterone. And because of these the hair growth and the weight gain, that all masculine body is all symptom is because of testosterone present. Insulin resistance, because of insulin resistance there is the arrested follicle maturation. There is multiple small follicles seen in the picture during the sonography. And there is chronic anovulation, chronic circular anovulatory cycle is there. Now, because of this, there is poor egg maturation, and there is a reduction in the implantation procedure. So definitely this affect our fertility rate. Now, if we look towards the ovular disorder, another ovular disorder, that is anovulation, or we can say hyperprolactinemia, thyroid disorder, even premature ovarian insufficiency. Nowadays, we come to know a lot of cases of premature ovarian insufficiency, and that the follicles are reduced as inappropriate with the age. Right? If the female is of 30 years of age and the ovum insufficiency is there, then there is definitely an ovulatory cycle or irregular period, low matured ova is released, and that is not able to fertilize a healthy sperm, and fertility will definitely hamper in that case. So how we come to diagnose that case? We can come for the hormonal issue, hormonal level, FSH, LH, and AMH. AMH will show us the ovarian reserve. So because of AMH, we come to know that how speeden up we have to do in that case of fertility. So follicular monitoring, thyroid profile will definitely helpful in the cases of infertility. Now we come towards the uterine factor. In the uterus, endometrium is the main thing which we need for the uh, implantation of the fertilized ova. So the commonest factor in uterus we can see that is endometriosis. And so endometrial tissues are growing outside the uterine structure, and it will impair the fertility of that patient. Now, common site for the endometriosis, that is ovaries, fallopian tube, pelvic peritoneum, and recto-uterine pouch, that is rectovaginal septum. Then key symptoms for the endometriosis, that is there may be chronic dysmenorrhea, chronic pelvic pain, dyspareunia, impaired fertility, or pain during the intercourse, and there or even during the bowel movement, there may be constipation also. And how we can diagnose? We can diagnose with the laparoscopy and ultrasonography. This will affect our fertility through altered implantation. It will not allow the implant fertilized ova to implant in a proper site, or whether it is implanted, then also there are more chances to lose that pregnancy. Tubal disorders. So common disorders, that is PID, pelvic inflammatory disease, whether it is acute or chronic PID, that definitely lead to salpingitis, acute or chronic salpingitis. The salpingitis then over lead to narrowing of the tube or blockage of the tube. So the transformation of ova from ovary to uterus cannot take place, and then it affect the impaired fertilization, and pregnancy is not conceived in that case. Moving towards the male factor. So around all men, 40% of male are responsible behind the fertility of that couple. So the symptoms, specifically male, so here the symptoms of varicosis, that is typically we can examine and diagnose that case, and it will, because of this varicocele, there is increased scrotal temperature, and as the for the spermatogenesis, the temperature should be 2 degree lower than the normal body temperature. So if the temperature is high, it definitely reduces the spermatogenesis process, or it affect the quality of sperm, and then it will reduce the fertility. Main factors for the abnormal parameter of the sperm, that is oligoisospermia. Very low amount of sperm are present in the semen. Then astenosospermia, that is reduced sperm motility. Sometimes the good amount is present, but there is no motility. Then there will not be fertilization on time. Teratospermia and azoospermia, that is complete absence of sperm. In case of azoospermia, there are very low chances of getting pregnant, or and very low chances of also improve with the medicine. Now the male factor, that is specifically hormonal causes, that is hypogonadotrophy and hypogonadism. So gonads are developed, but a low level of hormone is there. That may be a hyperprolactinemia, and that is low testosterone level. Because of low testosterone level, somatogenesis process is hindered. So available in enough quantity, or the quality is also reduced because of the hormonal level. Then if we move towards testicular cause, there might be a genetic disorder, Klinefelter syndrome, or trauma or torsion to the testes, or the commonest thing in society, that is mumps orchitis. The people have fear of sharing that mumps, but and when they come to know that fertility is not happening, we evaluate that mumps, case, and we come to know the mom's arthritis in that case. So, symptoms of this hormonal and testicular disorder, there is low libido, low sexual desire, erectile dysfunction, small testes, or sometime in some cases delayed puberty can also be seen along with the fertility. So, if we evaluate the history of that patient, there is delayed puberty, and then we come to know the hormonal disorder through that fertility. We can definitely go for the hormonal profile for that case. Testosterone, FSH, LH, prolactin. There's all hormone we need to check in that patient. And obviously, the genetic studies, specifically in the Klinefelter syndrome or the Nernst syndrome, in that case, study with now sexual dysfunction, whether it is male or female, in both the cases, both partners should be evaluated at a time. So we come to know if there is erectile dysfunction, premature ejaculation, or retrograde ejaculation. At the same time, female is having vaginismus or reduced libido or any sexual disorder is also there. So through with this communication with both the partner, we can come to know their anxiety, depression, or whether they have relationship issues or diabetes or neurological disorder or hormonal imbalance in that. So when we evaluate both the partner together, we can definitely increase their natural ability to conception together. We have told that there are 10 to 20% cases where there is unexplained infertility. There is we have evaluated both the partners, we have done all reports, everything comes normal, then also there is infertility. So we can say there is no identical cause behind the normal investigation. There are eggs are good, the sperm is good, the implantation defect is not there. Even tubes are also functioning well. So in that case, initially we can evaluate hormones in both the cases. In case of male semen analysis and hormonal profile and scrotal ultrasound. In case of female, we can go for the serial ovular sonographies. So how ova is getting mature, we can come to know. Hysterosalpingography for the tubal factor and routine hormonal investigation, that is AMH, FSH, LH, and thyroid and prolactin. So, as the fertility is multifactorial, the hormones, anatomy, genetics, lifestyle, and stress and mental factors should be evaluated at the same time. So, both the factors should be given a same important, male as well as female. Then we come to know the solution for that infertility. Now, modern medicine, as it is working on its way, but we are towards the homeopathy. So, it complements the understanding that individualization and emotional state endocrine balance can be restored and hormone through it, and we can improve the egg quality with the help of homeopathy, with the help of holistic method of homeopathy. Now, what is the homeopathy that we all come to know that it's invented by Dr. Hahnemann in the 18th century. It is deeply personalized. So if there are 3% together in the infertility case, we can come to same diagnosis, but for all three patients, we have a different medicine. So it will definitely treat a person's emotions, physical things also, and mental aspect also. So altogether, we can come to improve the hormonal level of that patient, and we can come to reduce the fertility in that case. Now, like your likes, so the way person comes to us with the same symptoms we find in the medicine, then we able to give that medicine and we are able to cure that patient. How homeopathy supports fertility? Now, is we are way towards the understanding the holistic way. So here in understanding the root cause, first of all, the hormonal imbalance. We have to rule out the level of hormonal imbalance, at which level hormones are imbalanced, the ovulation disruption is there, or the cycle disturbance is there. Ova is normal, ovulation is on time, but endometrium is not there. So we have to find out the goals, whether it is lifestyle, everything, environmental, everything together, and that affecting both partner or a single partner. So we have to treat that root cause first. Now, for the treatment, we have lots of medicine based on the individualization, treatment history, and emotional state of the patient. For example, Agnes forms sperm quality. Agnes will definitely improve the sperm quality. So these are the therapeutics. Medicine may be different for person to person, but these are the some commonest medicine which are used for that. Now we can boost reproductive health. We can enhance the egg and sperm quality through the whole person care. We are treating the person as a whole, right? Nutrition and emotional support is also should be indicated, as that will improve the lifestyle and manage the stress in that person, and it will add fuel to our treatment along with the homeopathic treatment. So this will improve the natural production of the egg and sperm. It will regulate the cycle, balance the hormone naturally, and creates the environment that conductive for the conception. So it will definitely improve the conception of that patient. Now, if we towards the female infertility, if we are addressing the female infertility, the key point here is we have to find out the ovulation, if it is proper or not through the menstrual cycle, then PCOS, endometriosis, hormonal cycle, and it supports the ovulation. Endometriosis reduce the pain of endometriosis, and it will restore the uterine normal endometrium. Then it will also help along with the lifestyle integration, like address the stress and nutrition, so it will improve the egg quality. Addressing for the male infertility, we have already discussed Agnes works well with the quality and vitality for increment of the sperm. Overall sperm quality will improve. So sometimes person comes with the low sperm count or poor mortality or abnormal morphology. In the all case, Agnes works well. Lycopodium specifically targets towards the sperm motility issue when there is a low motility or low degree sperm count, that lycopodium will work. Now, emotional and stress related infertility, we have told that there are 10% unexplained infertility there. So, in this case, chronic stress disrupts the hormonal imbalance and impair the reproductive function. Though the emotional health sometimes overlooked in case of fertility. So, here we have to find out which is the stressing factor in that case, whether it is prolonged stress or acute stress, so that will elevate their cortisol level and interfering with the ovulation and the spermatogenesis and hinders the implantation. Phosphoric acid dose is one of the good homeopathic medicine for the emotional trauma, grief, and this will help in restoring the emotional equilibrium as well as the reduction in the mental stress or mental clarity in that case. So, along with all medication, we need a proper counseling. So, homeopathy addresses some mind-body connection holistically. So, we need to counsel the patient first, along with preparing the patient for the homeopathic medicine. We come towards the miasmic evaluation. So, miasm is one of the key factor in homeopathy. We are believe that it is a dynamic, invisible fundamental cause behind the any production of the disease. So if we see there is a disease in case of fertility, then we definitely evaluate the miasm of that infertility case. Here, infertility often develops through the progressive of the miasmatic state. Right? Initially, if the person is having functional disturbances and it is uncared, the functional disturbance obviously it's psoriatic miasm. So if it is uncared, it will manifest as an hormonal imbalance. If there is a beginning of hormonal imbalance, we are not treating that case, and in progressive, it will definitely impact the structure. So definitely leads to the psychological changes in the structure, for example, cyst formation or the fibroid or PCOS. These all are the psychotic changes. Then further in advancement of the psychotic stage, that is syphilitic, that is degeneration or some resulting into irreversible damage. So the progressive will be highlighted through one table. We have prepared one table, tubular representation of the miasmatic correction in case of infertility. So if the case comes to you with the functional disturbance, is just a disturb in the cycle, there is inovulation, though lock sexual desire in case of male lead sperm. So it is a case of unexplained infertility. It is at the level of psoric stage. We can treat that case wonderfully with the homeopathic medicine, and there are good results in case of infertility. For the psychosis, there is though the psychotic nature is proliferative. In case of female, if we are looking towards the PCOS, fibroid, ovarian cyst, ovarian tumor, these are all psychological factor and psychotic factor. Sorry, that will affecting the female features. So if we found that female case with the psychotic symptoms and we are not treating that, that will definitely move further on towards the syphilis. In case of male, there is varicocele and the prostate issue is there. So this will all lead to cystic infertility. Infertility is there, but we can say it's at a psychotic level. Then syphilis miasm. So we know the nature of syphilis, that is always destructive. There is, in case of female, we find impaired tube or blocked tube or miscarriage or tubal pregnancy. This is syphilitic nature. And in case of male, we find azoospermia. It is very, very low sperm count or absence of sperms. So previously there is spermatogenesis, but as the structure impaired, structure destruct, the spermatic count destruct, and at the end there is azoospermia. So there is a recurrent pregnancy loss or very, very low chances of getting pregnant in case of syphilis. Sometimes you find a mixed kind of, so there might be multiple pathogens involved in that case, and that leads to chronic infertility. Now, personalized remedies reaction for the treatment portion, as homeopathy believes in similibus curantur, we have to select the simillimum medicine for that will support. We can resolve that stress related issue with the help of medicine, and we can generalize improve the health of the patient, generalize improving the natural hormone production in their body. Now, when we go for the treatment, we have to monitor the progress and moving forward. So we need to evaluate the patient monthly. We have to take reviews. We have to take reviews from the patient, and we have to counsel both the partner together. And we will definitely figure out the case of infertility. Now, couple who commit the full progression along with the healthy lifestyle that constantly reporting the best positive result, and that will improve uh, the cases of fertility with the help of homeopathy. Now that's some, do we have less time? But we are trying to include more and more homeopathic medicine for the case of infertility. So pulsatilla, very suitable for irregular ovulation, weak progesterone level, PCOS cases, and the women who are having irregular menses, suppressed ovulation, and low progesterone level. So we find the symptoms like delayed ovulation or the key feature of pulsatilla that is always needs a fresh air but was in warm. So if we got that key features, so pulsatilla will definitely improve the hormone level in that case. The person if having a history of birth control pills, and because of that exogenous hormones, the natural hormone production of that female is reduced, and we can improve that case with pulsatilla. Natrum is also one of the good medicine. Stress induced infertility. Those people who are having other things normal, but mental factor is more in case of Netramute. There is a regular ovulation. There is a loose cervical mucus, dryness of vagina is there, and some emotional and suppression is there. So in that case, Netramute works well. Sepia, for the hormonal imbalance, luteal phase defected, specifically the second half of the ovary, second half luteal phase defect is there. And because of luteal phase defect, mature ova cannot be released on the time. And because of that, fertility cannot be happens. So the key symptoms of sepia, that is scandimensis, or we can say all kind of menstrual abnormalities are there in the sepia. Fatigueness and mood swings, indifference to those whom she loved best, the key feature of sepia. So even there is a recurrent history of miscarriage, conception is there, but implantation is not proper. So sepia will works well. Calcarea, it is written in the body at it will improves the fertility, right? It will given for easy conception. So for PCOS, late ovulation, or even the weak quality of egg is there. Calcarea will also definitely helpful in case of hormonal and metabolic issue. It will improve the natural hormone release, and it will clear out the conception. Lycopodium, specifically in case of polycystic disease, Lyco works well. Lycopodium also works well with the motility of sperm when there is the low libido, hormonal imbalance, acne because of hormonal imbalance, uh, impaired sperm count, reduced motility of sperm. Lyco will works well. Sabina is moreover, we can say the psychotic factor of infertility is here. So here infertility with the uterine fibroid, there is tendency of miscarriage, there is excessive menorrhagia and metrorrhagia is there in case of Sabina. So when there is a history of miscarriage, definitely we need to give Sabina to that patient. Panaceous, good medicine for treating or strengthening the uterus and improve the egg implantation. Will works well with the endometrium, all endocrine conditions, and it will help in increasing the natural hormone in our body. Oramet, good medicine when there is mental affection is more affected along with the infertility, specifically depression, and because of depression, hormonal imbalance is there. There is irregular ovulation and the absence menses. So this all works well with the orum. Some biochemic medicines, which we have learned in the Dr. Susla's tissue remedies. Some biochemic medicine will definitely helping in boosting the fertility. It will help in promoting the conception easily. So these are the Calcarea force 6S, Kali force 6S. So that can be Parenthoods 6S and Natrum sulf. These all four medicines are works well with all the systemic in our body, and it will improve the natural hormone release in our body. Now, if you move towards the diet and the lifestyle tips for the naturally enhancing infertility, so a well-rounded lifestyle lifespan will plays the key role in improving fertility. Specifically, when we are planning for the conception, we have to prepare our body for the holistic habit for natural releasing of good quality of sperm and ova. So our main focus is to boosting the food, specifically food which rich in protein and amino acids, specifically nuts and seeds, almonds and flower seed, flax seed, pumpkin seeds. These all will rich in antioxidants, and they are containing essential proteins and vitamins. So it is very helpful in boosting the fertility. Avocado, eggs, berries, whole grains, these are rich in some nutrients. Green leafy vegetables containing more amount of calcium and potassium. Cal is also works good. Than other fruits and vegetables which are rich in zinc, selenium, iron, and folate. We need to take that to improve the natural fertility rate. Now, some stop, we can say stop to that food. That is, we have to limit or eliminate that things from our diet. That is caffeine. If the person is drinking more than 2-3 cups of coffee a day, it will definitely hinder the conception. So caffeine works on the hypothalamus pituitary axis that reduces the control of the hormone and that will affect the fertility. Alcohol, some processed food, sugar, this will leads to insulin resistance, and because of that, hormonal imbalance is there. Now, body weight. Body weight is also one of the factor which we are aiming. That is, BMI should be between the 18 to 24, and we have to prioritize the uh, feeling of the person overall. So, exercise regularly, daily 30 minutes walking, yoga or pranayam that will improve the disturbed hormones, that will improve the quality of sleep, and it will help us to manage the stress naturally. When there is chronic stress which elevate the cortisol, we have seen the pathway how cortisol improving our natural hormonal production. So practice daily stress reduction activity like yoga or pranayam, medication, breathe pranayam, journaling, nature walk, and some creative hobbies. This will relieves the good hormones in our body and affect the fertility rate of that person definitely. So how we can track the ovulation, how we come to know that ovulation is taking place in our body naturally or not. There are so many methods, amongst that BBT and the ovulation tracker. Nowadays, LS search kit is available, so we can come to know the ovulation is happen on time or not. Cervical mucus test, that is two tests are there, fin bucket tests and the stress test. This will help us the level of progesterone present in our uh, body. It is all about our infertility. If you have a question, uh, you can ask.
Thank you very much, ma'am, for such a wonderful, informative, and thought provoking session. Your practical experience, clinical insights, and holistic approach have certainly enhanced our understanding of fertility management in homeopathy. We sincerely appreciate the time and effort you have devoted to sharing your valuable knowledge with all of us. We shall now move to the interactive questions and answer sessions.
Yes, only a few minutes, only 4 minutes remaining. Uh, yes, as Vivek Prasad Pandey sir want to talk.
Yeah.
Phil.
Yes, sir.
Uh, Dr. Poonam, you have nicely presented from the anatomy, physiology, pathology, as well as gynecological problems for infertility. So my question is, what is the point in which we have to refer the patient to gynecologist or obstetrician?
Uh, Thank you, sir. Such a interactive question. We have to refer the patient to obstetrics when, first of all, we are hoping for the positive result. So as soon as we got a positive result with our case, we should send the patient towards the obstetrics. If we are not getting result on that way, we have to evaluate the patient. If there is some syphilitic disturbance is there, for example, higher case of endometriosis, there is a severe disruption in the uterus, tube, and ova, everything is stuck together. So there is impaired movement. For that case, we need to refer that female to the gynecologist. Or in some case where there is severe obstruction in the, for example, in case of male, there is severe obstruction in duct, efferent ductules. So we can refer that patient to the allopathic side, and if we come to know that resolution. But along with that side, we can also give homeopathic medicine for improve that hormonal level naturally. So that is also helpful.
Thank you.
Yes,
Thank you.
madam. Madam, I would like to say a few more things because this being an international forum and a
Yeah.
forum for promoting homeopathy in the public. So, what we need is we will have to present at least one or two cases where we will have to, we can cut short the anatomy, physiology, pathology, and all those things. But in a nutshell, you can say, but it is better to present some cases because this when the video is being uploaded in the YouTube, people uh, will come to know about what is happening with the homeopathy in all these things. That's what to be promoted.
Yeah,
So anyway, your
we'll
presentation is
definitely
really.
share the case
So you may come prepared
in
with some cases only for the next
later
time.
on lecture. We'll in next lecture we'll surely work on a
Yes. Definitely, we need that kind of
specific
at least two to
cases.
three cases.
We have one case of tubal blockage.
Okay,
Yeah,
okay,
sure.
that will be a big
There
boost
was one
to the
question
homeopathy children.
pertaining of the
Yes,
sure.
your network has some problem. So it is over to Dr. Wrinkle to come.
As we come to the end of the today's webinar, I extend my heartfelt gratitude to our respected speaker, Dr. Poonam and Meghani ma'am, for delivering such an enriching academic session. Before we conclude, I would like to encourage everyone to stay connected with IFPH beyond today's webinar. Most of our previous webinars featuring renowned homeopathic experts and a wide range of valuable academic topics are available on our YouTube channel IFPH Homeopathy. If you found today's session interactive, please subscribe to the channel, watch the previous recordings and share them with your colleagues and students to help spread the knowledge of homeopathy far and wide. Thank you all for joining us. Stay connected with IFPH, continue learning, and keep promoting homeopathy. Have a wonderful evening.
Yes.
Thank you so much, Dr. Rinka, Dr. Ganesh, and IFPH for this wonderful opportunity of sharing this valuable session with us.
Thank you all. And tomorrow we will have a session from Dr. Chaya Patil. She is also a professor and HOD Department of Gynecology and Obstetrics from Kolhapur, Maharashtra. And we'll be talking about homeopathic management of menopausal syndrome, experimental non-controlled study. So another research update is coming for tomorrow. Thank you all.